There are many things that we can do on our own to maintain our physical well-being, which is one of the 5 pillars of designed resilience, making sure that every day we're doing something good for our bodies. But we can't do it all by ourselves. I grew up in a family that believed that it was a good idea to have relationships with care providers, doctors, dentists, eye doctors, so that you could have a baseline so that they could help you identify any anomalies or help you take care of healthcare issues by nipping them in the bud. And so one of the habits that I want to talk about in the realm of maintaining your physical well-being is going to the doctor. It's always fun. It's not always exciting, but I have found in my life that by maintaining relationships with healthcare providers that I have been able to head off certain issues early, and also understand from a year-to-year basis how my health is progressing. My name is Rachel, and this is Designed Resilience, the corner of the internet where we talk about building daily habits and practices to help you have the resilience you need when things are amazing, because that takes stamina, and when things are hard, because you need that support system to help you get through it. So today I want to talk about the benefits of going to the doctor as part of your physical well-being maintenance schedule. Now, I understand white coat syndrome, this kind of fear of going to the doctor. And so I want to start with how to allay some of those fears so that we can get into the benefits of why having this as a practice, not a daily practice necessarily, but a regular annual practice in maintaining your well-being. So being afraid of doctors is super normal. It's kind of like being afraid of car maintenance shops, because the news that they can give you can be really great or it can be really bad and scary. And so as I have navigated some of the fear around going to the doctor or the dentist or the eye doctor, there are things I've done to help me be prepared so that I can get the most out of the visits. And so one part is being prepared, is understanding why I'm going on the visit, documenting for myself any questions that I want to bring to that certain care provider, concerns I have, or things that I may be noticing about my body or my health that I want to talk to them about, so that I don't get into the visit and just my mind goes blank and I completely forget all the things that I wanted to bring to the visit, in addition to the standard checkup and care provided. Another thing that I try to remember is to breathe. I know that going to the doctor, especially if you only have an annual cadence, is nerve-wracking because it's unique to me. But this is something that the doctors and nurses and care providers do multiple times every single day. And so I can take a breath, because the anxiety that I'm feeling is not necessarily going to be reflected in the anxiety that the physician or nurse or tech might feel. And so I want to help to calm myself down by breathing my way through these visits. So if I do have anxiety, I acknowledge it and I take steps to mitigate it in the meeting. So I've got my notes, I'm prepared, and I'm breathing through the experience. If white coat syndrome is overwhelming and you want to implement this practice in your daily habits or annual habits for maintaining your well-being, bring an advocate. Bring someone with you who can either sit in the waiting room as a calming support system. I have done this for friends, and I have had friends, and my sister specifically, do this for me. If I was going for a visit, I didn't necessarily need them in the room, but I wanted their support. And usually we would follow the visit with a treat for ourselves, which was a nice way to sort of bundle a stressful engagement and something that feels supportive. Or if you are going to a doctor's visit and there's going to be complicated information shared, having that advocate come into the room with you, because you're hearing information from the doctor differently because it affects you and your health, but your advocate can be listening from a more objective perspective, so that they can help you remember instructions or ask questions that would have been necessary, but maybe not something that you're thinking about as you're thinking about what the conversation implies for your health. So Before we even get into the benefits or how we should structure our visits to the doctor as we're taking care of our physical well-being, managing the stress and anxiety going into it is a helpful thing to do to be able to make that a valuable exchange. So we're going to be prepared, we're going to breathe through the experience, and we're going to bring someone with us if we need them. Now, when I think about structuring my annual habits around visiting the doctor, they're largely dictated by insurance coverage because that's what helps me go to the doctor. And if you don't have insurance, of course, this is going to be different for you. But if you do, most insurances will cover preventative care. And so for a regular primary care physician, that means an annual physical where you might get blood work done, that they're going to just kind of check your overall health. For dentists, that usually includes 2 cleanings a year, maybe a set of x-rays once a year, but getting those touch points in at a regular interval will use the benefits that you are paying for through your insurance and also allow that care provider to have a record of your progression to see if anything new or interesting is happening. And then for me specifically, I need to go to the eye doctor every year because I wear contacts and glasses, and the prescriptions for those lenses expire within a year. So I will try to use the preventative care benefits from my insurance program to make sure that I'm making use of what I'm paying for, and also to keep a regular cadence of updates about what's going on with my health. For women, you will also have the annual visits related to feminine health, so the breast exam and the pap smear. Your primary care physician can conduct those tests. And so if that is something that you're more comfortable with, just having all of that happen with your annual physical, that's something that you can take advantage of. Or you may have a specialist who does those visits for you. So just getting the natural annual cadence of visits is an important part of maintaining your physical well-being and building that relationship with your care providers. Once we have gotten kind of all of our visits scheduled, we will, and I usually will try to take a day or 2 days a year and just knock out all those appointments at one time. That helps me to schedule them. It helps me to have a bit more of a relaxed environment going into it because I've taken the day off of work and I can, book my appointments, giving myself enough time to have the appointment, to travel to the next provider if I need to. But I like to do that because it helps me focus on those events and I don't feel like I'm rushing back and forth or that I'm trying to do too much in a day. When you go to those appointments, sometimes they may say that there needs to be a second appointment, a follow-up, more screening, more testing. And this has happened to me a couple times in my life where I've gone in for my annual preventative care and there was something that care provider wanted to take a deeper look at. And so when you hear that, that's not what you want. You wanted to be able to go in, do the appointment and kind of be done for the year. But I have learned through those experiences that it's best not to worry about anything until there's something specific to worry about. There can be anxiety when you go for a visit and they're trying to get you a follow-up for something that was unexpected, whether it's a skin screen, maybe they found a freckle or a mole that looks interesting, or, in the breast exam, they found something that felt a little anomalous. And so as I've had to go for these follow-up visits, I have been so blessed that nothing has ever come out of it. The extra screening just let the care providers know what was going on and to be able to watch it to see if anything changes in the future. It's such a relief to hear that when you're in a follow-up visit, but I wouldn't have known that I needed more screening or that there was something to watch in my health without having that annual cadence of visits. So I just tell myself, don't worry about something until there's something to worry about. And that has helped me to manage my stress, because that can be part of the fear of going to the doctor in the first place. Is what are they going to find? What do they need? What are they going to want to look at? And so I don't worry until there's a diagnosis. And that has helped me not be so scared to go in at the beginning. Some of the benefits that I have experienced by keeping this regular cadence of annual preventative care and doing any follow-ups that were requested by the care provider is precancerous cells have been caught early for me and been able to diagnose and be watched. And, that's been good to know, and good to know that there's a care plan if anything became necessary for further treatment. I actually also had prediabetes caught. Diabetes runs in my family, and my precursors for diabetes were getting a little higher. And so I was able to make lifestyle adjustments and bring those numbers back into the normal range, which made me feel very capable and very much like I could impact my health because I had the information that I needed. So I've been able to take control of some things. It wasn't, these situations in my health were not so far gone that I had to rely only on the healthcare system to help me take care of it. And I find that really empowering, and part of the reason why I do maintain my annual visits is because I want to have the longest runway for getting my health back to where I want it, as opposed to being surprised and then all of a sudden needing a lot of intense treatment. One of the things that can make this easier is building a good relationship with a good care provider. So what do I look for when I am meeting a new physician? I had to do this recently as I moved states with my husband. And so all of my previous care providers were not going to be accessible anymore. And so some of the things I look for when I'm establishing a new care relationship are convenience. Are their offices close to me? Are their hours workable for me? Do they have the facilities that I'm going to need? And granted, all of that is within the bounds of the network that my insurance covers, but I can make choices that provide me with convenience that I'm looking for. I also kind of assess the care provider from the beginning of the interaction all the way through. So even the way that I book appointments and interact with their staff. Are they helpful? Are they friendly? Do they work with me and my schedule to get the appointment made? Are they clear in the instructions? If there are, like, if I need to fast before an appointment because I'm going to have my blood drawn, are they communicative about those things? And all of that creates a much more smooth and makes me feel more confident as I go into these visits. Trying to find doctors that don't give you the ick. I have had different experiences throughout my life where there were care providers that I felt were very attentive and were there specifically in my appointment to work with me. And I've also had experiences where I felt like I was at a cattle call and kind of just being shoved through the process and moved quickly in and out. And I don't want that. So I pay attention to those things and know that I may not be visiting that physician or that office again. I appreciate when a care provider listens, and I feel like I facilitate that by being prepared, by bringing my questions or, my notes to the appointment so I can keep a focused conversation, and it gives them the opportunity to listen if they're going to. And I think with healthcare moving so quickly and having so many people at each practice to be taken care of, that's a very special indicator of a care provider who's going to help me along my journey if we need to go into any more intensive diagnosis or treatments. If they listen to me when I'm just, a patient coming in for an annual visit or a regular checkup, kind of a well woman situation. So taking care of my physical health in as much as in my control with the food that I eat, moving my body, hydrating, getting sleep, managing my stress and all of that, that's all very important. But I do think it is very important to have a board of directors of your health and care providers that understand you and have had the opportunity over time to see what your body rhythms are, what normal is for you, what abnormal is for you. And so the easiest way to do that is, if you do have health insurance, to take advantage of those preventative care appointments. Try to group them all together so you can get it all done. Take a couple of days off work to manage that. Although, many employers will work with you about the time to take doctor's appointments and things. But it's something that was ingrained in me from my childhood, that it's better to know early so that you can manage any health issues than to wait until they're so bad that you have no choice, because your body will tell on you. And it's better to have professionals walk alongside you as you go through life to help you manage anything that you can't do on your own. So I hope this is helpful. I hope that you'll consider adding those annual and biannual visits to your daily practice of maintaining your physical well-being, because I've heard it said that you might have a lot of problems, but if you have health problems, you only have one. So let's make sure that we get ahead of those and that we don't leave it because we're afraid of the white coats, but we have a plan to address it. We know that there will be benefits when we take care of ourselves. We build good relationships with care providers and let them help us when we need them. I hope you found this helpful. And if you did, I would appreciate it if you'd consider dropping a like or subscribing to the channel. And we'll see you next week.